More than 1.5 million Texans could lose their health insurance as changes to the Affordable Care Act loom in the wake of passage of the president's tax and spending bill. That is all according to analysis by health policy experts who spoke to the Texas Tribune. And joining us this afternoon is the Tribune's Washington correspondent, Maddie Birnbaum. Gabby, thanks so much for being with us. We appreciate it.
Thanks for having me.
So there was so much attention, and we talked a lot about the Medicaid cuts portion of this bill. And what does it do, though, to the Affordable Care Act that could have an impact on Texans?
Yeah, I think this is an element of the bill that's been under discussed, but is projected to have a pretty large impact in Texas. There are about 4 million people currently enrolled in healthcare through the ACA in Texas. And the analysts I talked to project that about 1.7 could end up losing their coverage, either because of tax credits that have driven premiums down that are expiring at the end of the year that Republicans did not include in the bill, or through changes Republicans are making to make eligibility tax checks much tighter for the ACA, ending sort of the automation that allows you to get your plan year to year, and just adding a lot more elements of documentation to it that are going to end up, having people not realize they needed to do that and losing their coverage.
And we mentioned there that more than 1 million people could lose their coverage because of this law. So how did the experts you spoke to arrive at those numbers?
Yeah, I mean, I think they started with, the nearly 4 million who are enrolled in the ACA, especially because ever since the passage of these what are called enhanced premium tax credits in 2021, they allow more people to claim the tax credits that apply, towards their monthly premium and, apply to cost ceiling so that people's premiums went down. Ever since those went into effect, enrollment has skyrocketed in Texas. And so I think the thinking is without those credits, when people's premiums go up, they're just not going to be able to afford the care that they're getting right now on the marketplace.
And obviously opponents of some of this have been speaking up loudly about the impact of this. But what have supporters said about why they wanted to pursue these kinds of things that could affect the Affordable Care Act?
Yeah, I mean, I think it's sort of the two arguments we're seeing. Number one is waste, fraud, and abuse. Republicans are arguing that there's rampant fraud across the ACA marketplace, and they want to crack down on that by having more frequent eligibility checks and enrollment checks. And number two is spending. These enhanced premium tax credits are costing taxpayer money. And we'll see. A deal could be still be struck by the end of the year to extend them. But right now, the prospects don't look too good just because the mood in Washington is so anti-spending at the moment.
Well, we'll be watching that very closely moving forward, so we might have to have you come back for another conversation. But Gabby Birnbaum with the Texas Tribune, thanks so much again for joining us this afternoon.
Thanks for having me.
And now we want to